Well, good morning, everyone. And once again, welcome to another live this morning. One of our favorite days, question and answer Friday. And we like to say hello to some dear friends here, do a little roll call, see who's watching live, and we appreciate that big time. We consider you family. There's Brahim. Number one, Andrea. Number two, Mike Norland. You guys, I'd love to know your tricks to get up at the top. And Sandy, you're always there near the top. We appreciate it. Nativity, good morning. Janice from Brampton, how are you? Kathy, how is you? And Doc McEwen, haven't seen your name in a while, but I guess I miss it so often. Leela, Rhoda, Frida, how are you? And Diane, Thunder Bay. Nick from our staff, good morning. Fran, Orangeville. Faye, nice to have you on. Catherine from Newfoundland and Linda from Uppsala. And Thea, good morning. Linda, two Lindas, yes, Owen Sound. Georgie, Halifax. Nova Scotia, Nellie, Karen, and Maria from Ottawa. Good morning. Brandon, Babita, how are you? Kelly, London, Ontario. Yalan, long time no talk. Dale, how are you? Elmira, Shirley, and Darlene, good morning. Saskatchewan. Dale. Did I just say hello to you, Dale? Patricia. Sherry from Mississauga. Carol. Am I foggy? I thought I cleaned that off here. Okay? Yeah, I do look a little foggy, eh? I guess it just, I don't know. I thought I cleaned those lenses. And Rita, how are you? Gary from Bolton, Patricia, Florida, Judy, Port Perry, Kathy, how is you? And Ann, Moncton, New Brunswick, and Nina. Okay, a couple more guys and we'll get going. Laurie, Cambridge, Jolene, and Reg from New Brunswick. Yeah, see, everybody's saying I'm looking foggy. Hey, guys. Try and fix it for the next time. Joanne from Eganville and Cecilia, dreamy. Jude, hi everyone. Janice, he is foggy. Okay, don't let it bother you guys too much. Rosalinda, in the clouds today. Susan, good morning. And Marina, Deer Lake, Newfoundland. Linda, and Wendy, how are you? Two Wendy's in a row. Sandy, still foggy. Yeah, I don't know, guys. I don't know. I can't figure it out. I tried to clean those lenses on my phone, but who knows? I'm not going to worry about it too much today. Okay, let's go through the questions. We got a fair amount of them. I try and get through all of them this morning. Okay, let's bring over here. And Jolene. Okay, what does Dr. Martin think of eugenol, which is clove water? Is it better than oregano oil? What do you think? What do you think I'm going to answer? Jolene, if you're new on this program, maybe you don't know the answer. But for those who have been following the Doctors In podcast for quite a few years, and before that, the Doctor Is In radio show for many years, nope. Oil of oregano is, look, clove water or eugenol, I got no problem with it. If you like it, go for it. But you can't, it's antibacterial, antifungal. Nature's antibiotic is oil of oregano. Proven. Research. And oil of oregano is at the top of the chain when it comes to oils as an antifungal, antiparasitic, antiviral, and the clove water or whatever, hey, might be all right, but it ain't near the top when it comes to comparing it to oil of oregano, okay? Good, better, best. I've always said that. There's good things, there's better things, and then there's the best things. The best is oil of oregano as far as that goes. Thank you, Jolene. I appreciate the question. Okay. Noeline. We got Jolene and then Noeline. Vaping. How bad is it? I wouldn't touch it with a 100-foot pole. They're starting to see now lung damage and long-term effects of vaping. I wouldn't touch it. I mean, who needs that? Is it better than smoking? Probably a little bit, but neither one of them are good. I would say, Noeline, run. And anybody that asks me about it, I've been asked many a time, what do you want to do that for? That ain't good for your body. Stay away. Okay. And Dale was asking, what does Dr. Martin think of moringa? Well, moringa had its day in the sun a long time ago, by the way. Okay? There was companies out there that were pushing moringa, that it was the best thing since sliced bread. I mean, like I said, I've told you this, and usually this happens on Friday, question and answer Friday. I get a lot of questions when it comes to products or supplements or, and I like that. I got no problem with it because I did it on my radio show for years, and because I had a radio show way before I had the podcast, people would bring information. I mean, there was always someone from all over the place, by the way, trying to get my attention because they wanted to get some promotion on my radio show. So I would get every week something new. Moringa, it was very popular. I'm going to say 15 years ago, maybe 10, 15 years ago. It had its day in the sun, and everybody and their dog wanted to know about moringa. It cured everything from pimples on your nose to warts on your toes. And I said, well, let me look at it. I got no problem looking at stuff. But, when it comes to blood sugar, because that was its big thing, use it for weight loss. It'll control your blood sugar. That was one of the biggest things they talked about all the time. And I never found it to be exceptional. I had a lot of patients that tried it. I like cinnamon better. I like alpha lipoic acid better. I liked our insulin formula better for that. I like quercetin better than moringa. So I got no problem with it. But again, it comes back to good, better, best. And it's not the best. It's not the best. And it's all right, though. I'm not saying there's anything wrong with it. It's just that if you ask me, I always compare it to what I know. I was in practice for 50 years. I had to get results. And I have my protocol. I had supplements, my go-to supplements. And I had to get results with real people in a real clinic. And it's one of the reasons, by the way, it's probably the number one reason. I started to formulate, with my son and I, we started formulating our own products. Different combinations of things, and almost unheard of in those days. You know, you wouldn't just get moringa, you'd get a combination of things to help with blood sugar, for example. Thyroid, look at how many different ingredients are in there. Cortisol formula, look at how many different ingredients, because we found the combination. Okay? It's like when you go to a compound pharmacist. They compound different ingredients to get the one thing that they're trying to do. Okay? So that was us at the Martin Clinic. Thank you very much, Dale, for the question. Rita, what does Dr. Martin think about extra virgin coconut oil supplementation with osteoporosis? Well, I like coconut oil. Osteoporosis and extra virgin coconut oil, I wouldn't be my first choice for osteoporosis. My first choice for osteoporosis is vitamin D, big time. With K2, big time. Eat your calcium. Get in the sun. Get strong for osteoporosis. Much better than coconut oil. Now, I like coconut oil. I really do. I like extra virgin, cold pressed olive oil. I like olive oil. I do. I like bacon better because it's got the same oil in it. What makes olive oil so good is oleic acid. Okay? And I like olive oil. I'm telling you, it's good for you. But bacon's got oleic acid, and I like bacon better than olive oil. How do you like that? Coconut oil for osteoporosis, it wouldn't even hit my top 10 for osteoporosis. But it's good for you. Coconut oil, that healthy fat, I got no problem with it. I like it. Okay? Osteoporosis, not so much, Rita. Okay? Kim. She has lichen sclerosis. And lichen sclerosis is an autoimmune condition. I'm going to tell you something, Kim. In my experience with lichen sclerosis, and I saw it a lot of times in my office, and it can affect your mouth, it can affect your private parts, and with itching and burning, it's an autoimmune. Whenever, ever I talk autoimmune, I always talk leaky gut. Leaky gut. Okay? Leaky gut. You get a fungus. You get an invasion of the Trojan horse, I call it, yeast, candida, fungus, okay? Pick the word, it don't matter, it's all the same. That gets into the bloodstream and it travels. And when I saw lichen sclerosis, usually, not every time, but they usually had a history, autoimmune of antibiotics as a kid, for repeated throat or ear infections or whatever. You take an antibiotic and this and that, and it disrupts your microbiome. You get a yeast or a fungus that comes in. It gets into the bloodstream. It travels. And lichen sclerosis, to me, is a fungal infection caused by leaky gut. And the leaky gut got caused by ordinarily antibiotics. Doesn't always have to be that, okay? But that is a big culprit in our society today. It's one of the reasons we see so much autoimmune. Okay, so thank you very much, Kim. Oh, she's asking for a cream. What can I do for itching and cream? Well, like doctors will give you a steroid, usually, and you have to be careful with steroids. I'm not against them, but at the end of the day, it's not fixing the problem. I like a combination. There you would go with coconut oil, because coconut oil is an antifungal. Okay, it is. And so I would do a little salve with some coconut oil, a probiotic, open up the capsule, put a little bit of that powder in there, Kim, and make yourself a salve with that. Very good. A lot of people do that. Okay, thank you very much for the question, Kim. We appreciate it. Gail, what causes osteoarthritis and can it be reversed? Well, it depends. Okay. Osteoarthritis can be caused by a lot of things. I mean, injuries. Okay. You hurt your knee. I don't know how many times I saw men and women played sports, hurt their knee, and then they become bone on bone and get osteoarthritis. Osteoarthritis is in the joint usually, guys, because it's the body trying to get you not to move it. It hurts. The body lays down calcium and inflammation to try and heal. And it can be very painful. So people get osteoarthritis. Can it be reversed? I've seen it get a lot better. A lot better. Reverse, it depends. How advanced is it? But I'll tell you one thing, and I talked about this too. You know, you get the downward stream of insulin and insulin resistance. And one of the things it affects is joints. Okay? Joints can be affected by sugar and glycation. What we call the caramelization of a joint. Orthopedic surgeons know all about that. And all I'm saying is that a lot of times with people on the reset, they do 30 days and their joints are better. They have less inflammation. They have less pain. They have more movement. A lot of them. It was a common feedback that we would get. Okay? So I would do that. And I like osteoarthritis. You know, I'm big on our inflammation formula, if we can ever get it back. Gail said she tried curcumin and it didn't help. You know, again, guys, one thing, you know, like with a supplement, okay, like curcumin. I love curcumin. If I didn't love it, I wouldn't have it in terms of a supplement from the Martin Clinic. Wouldn't have it. But I love curcumin. But I always tell people, look, if curcumin don't work for you within a month or two, the first bottle, why do you think it will work in the second bottle? I used to tell my patients that. Take high DHA, for example, which I really love for osteoarthritis. And if you don't see the difference or feel the difference, well, why would you bother? I had to get results. You know, but just trust me and take this for 2 years. I never did that with people. You see a difference? It's working. Okay? You don't? It's not working. Okay, thank you very, very much, Gail. Cyril, what did Dr. Martin recommend for insomnia caused by nocturia? Nocturia is mean you're getting up to go for a pee 100 times a night. No wonder you're having trouble. Well, look, guys, I'm always big on fixing the issue, okay? So men, prostate, lower estrogen. You got to go to the bathroom frequently at night. Make sure you stop drinking water at a certain stage too. You know me and water, 2 liters of water. You need water. Everybody does. Everybody does. And only water is water. Okay, so we got that right? Okay. Now, so men for prostate, lots of men get benign hyperplasia, which is an inflammation of the prostate, and they got too much estrogen. Block the estrogen. That's why I love flax seeds. Okay? And maybe one day we'll have that hormonal back and blocking it with DIM. And the menopausal formula, ladies. Okay? So if you're up at night, you need some DIM. Okay? And the other thing that can cause frequent urination at night is a silent yeast in the bladder, especially in women. So fix that. Probiotics, okay? And oil of oregano. That would be my protocol to get rid of that, okay? But yeah, I mean, get to the root issue. Why are you having to go to the bathroom several times a night? Okay, women, it happens. The bladder is descending a little bit, a lack of progesterone. That's why we dim out the estrogen and elevate the progesterone in the menopausal formula. It's built for that. Okay. Francis, can you take gutties without knowing if you have IBS? Well, for sure. I love gutties because it has a lot of mucilages. I'm big on mucilages. And they coat your gut and regenerate the gut, like the L-glutamine. You get that, by the way, in bone broth too, okay? The L-glutamine regenerates the gut. I like that. You don't have to have severe digestive issues to take our IBS formula, because it's actually good. It'll help knit. It helps to reline the zipper so that between the gut and the blood barrier, okay? Because leaky gut's a serious issue, and a lot of people with leaky gut have no digestive issues. They don't have any digestive issues. Leaky gut can affect them elsewhere, like their joints, like their lungs, like their sinuses, like their brain. Leaky gut, leaky brain. The gut blood barrier can be regenerated. Probiotics, IBS formula, because of all the mucilages, plus it coats your gut, coats it. Okay? Like slippery elm and that. I love that stuff. Because an L-glutamine and the regeneration power, you want to regenerate that little epithelial lining within your gut. Yeah, you can take that for sure. I do. Okay. Tina, my daughter is in her mid-20s, and she has had 6 ear infections since July. Holy smokes. And now, can I ask the question, Tina? I know you can't answer right there and now. Has she been taking an antibiotic for it? That's usually what happens, okay? I'm just going to give you case histories that I heard about many, many times in the office, okay? You get an ear infection or a sinus infection. You take an antibiotic. Who can blame you? Okay? It's so painful and you're in trouble and whatever. The problem is with that. You take an antibiotic and within 5 days it'll kill all your friendly bacteria. Now you have what we call a dysbiosis. Not only in your gut, but everywhere where you have bacteria. You got trillions of bacteria, guys. It's invisible. You don't see it. But it's everywhere, especially where you have moisture in your sinuses, in your ear canal. There's a lot of bacteria, but there's good and bad guys, and they're sort of, they sort of round each other off until one becomes more dominant than the other. That's the problem with an antibiotic. It creates a dysbiosis. It affects the ecosystem. And then you get a fungus. I know I always come back to that yeast or fungus, but I'm telling you, that's what happens in recurring infections. I can guarantee you, Tina, I can guarantee it, that your daughter doesn't have bacterial. Even though the bacteria might be there, she has a fungal infection in the middle ear, in the ear. It's yeast that gets in there. It's invisible. You can't see it. And yet, it'll reoccur and reoccur. So, do the protocol. Oil of oregano, probiotics. I would actually put a little bit of powder. Get a Q-tip. Don't go in too deep. A little bit of oil of oregano. A couple of drops. Put a little bit of powder of probiotic. Just barely gentle. I used to do this in my office with patients. Put a little bit of powder and the oil of oregano, maybe a little bit of olive oil or coconut oil, and don't go too deep in there, just on the edges of the inside the canal, just on the edges. Don't go crazy, don't go puncture, nothing, but it helps to kill, and you got to do this internally too, inside and out. Okay, but I guarantee it, Tina, you don't get 6 infections unless you got a dysbiosis, recurring infections like that. And now it's becomes probably very resistant to antibiotics. Okay. And that was Tina. Judy, putting the bone broth in water, okay. Does that still count toward daily water amount? Nope. No, it doesn't. Judy, it's a good question, okay? But guys, what have I taught on this program? What have I taught? Water is water. Nothing else. Water is water. Okay? Now, you can drink coffee, but it's not water. I recommend you drink coffee, but it's not water. Okay? You put bone broth in water, good way to take it. Nothing wrong with that. But you're getting bone broth. Your water needs to be, because water, listen, when you just drink water, it takes a different route in your body. Okay? So if you put bone broth in water, nothing wrong with that. Goes through your gut. You get the benefits of the bone broth. Your body breaks it down, knows what to do. But water goes in nanoseconds. It takes a different route in your body right to your bloodstream. Okay? But it has to be water. Now, the best water, okay, the best water is spring water. Okay? That's nature's water. It's already got minerals in it. Spring water. That's the best water. You want to go spend money on alkaline water and all this and that? I don't buy that stuff. I really don't. Okay? Smart water. You know, where they get the pH up. Nah. Put a little pinch of salt in your water. Okay? You want to get the pH up. Don't spend the extra money. Okay. But only water is water. I've taught you that. Water takes a different route. It's into your body in nanoseconds. But if you're taking water and bone broth, well, your body's got to break that bone broth down. It's got to absorb it. And that's all right. It's good for you. but you're not hydrating the same way you do with water. Okay? Okay. Willie, so many people use Himalayan salt nowadays. Do you think that the lack of iodine is something to be concerned about? Well, Google says there's only a trace of iodine in Himalayan salt. Yeah, it's still a good salt. Okay? I like Himalayan salt. I like a good Celtic salt. You got all the minerals in it, including iodine. You don't get a lot of iodine. They added iodine to salt. Okay, but I wouldn't touch that table salt with a 100-foot pole because it's not really salt. It's not giving you the electrolytes that you need. Table salt has been demineralized. I wouldn't touch it, even if they put a little iodine in it. Okay? You want iodine? Eat steak. Have an egg. You got iodine in an egg. Did you know that? You got iodine in cheese too. Eggs, meat, and cheese. And add a little salt to your water. Okay. Thank you very much. That was Willie. Thanks, Willie. Danny, will being on the reset and staying on an EMC lifestyle get rid of plaque in your arteries? Well, and keep them cleaned out. Well, it's a good thing to do. And it's probably the best thing to do to keep your arteries clean. And I would have you on high DHA. I would take that. It would be my go-to, Navitol, for your arteries because it elevates your nitric oxide. You want to do all that. We did a little session yesterday, and we talked about that. And you want that, Danny, because food is the key, because we talked about, remember what I was saying yesterday and even the day before, coming out of Dr. Kraft, who was the father of diabetes in a lot of ways. I mean, there's probably no one that did more research. And he said, if you have atherosclerosis, which is plaque in your arteries, you're a diabetic. And you can't become a diabetic unless you're a carboholic. Okay? I think I read it yesterday. Carbohydrate overdose disorder. I like that. Carbohydrate, diabetes is a carbohydrate overdose diabetes. And so is insulin resistance, by the way. And 93% have a carbohydrate overdose disorder. And that'll affect your heart. It'll affect your heart. One of the main causes of plaque. Okay? Not cholesterol. Okay, Rita. Okay, she had a scan of her kidneys, told one kidney is shriveled. You had a kidney infection around 10. You can live with one kidney, Rita. You can live with one kidney. Better with two, but you can live with one. Obviously, you've lived all these time. You didn't even know you only had one working. You didn't know that. That infection killed your kidney, and, probably didn't do an ultrasound or whatever, never found it, and, you lived without it. And now that's all right. Stay in good shape, eat EMC, keep your carbs down, keep your sugars down. And you're saying, she's saying she got diagnosed with a fatty liver. Well, you know what, Rita? Listen, you got to keep trucking, man. Okay? Like you might have had that for 25, 30 years. Usually you can fix your liver pretty rapidly. But if you're feeling good, Rita, you said they discovered a couple of pouches of diverticulosis. Okay? Well, the reason you haven't even had any flare-ups is because you're eating good. So don't get discouraged about doing what you should be doing. You might be dead, Rita, now if you hadn't done it. You might have gotten liver cancer. That fatty liver might have turned to cirrhosis, then cancer of the liver. You know how many millions of people die because their liver They get liver cancer or pancreatic cancer. I'm telling you, it's like an epidemic today. So don't get discouraged, Rita. Like, it ain't perfect. Okay? I mean, I think if they examined everything in this 73-year-old body, I ain't perfect. You age, you're gonna die. It's 100% for sure. You're gonna deteriorate. Okay? You just try and slow it down. You're doing the right thing, Rita. Don't get discouraged. Hey, they found a couple of pouches of diverticulosis in your large intestine. Okay. Okay. Keep it at bay. Your body is able to regenerate. Maybe it won't completely fix it, but if you can keep it without symptoms, you're doing the right thing, my dear. Okay. That was Rita. Thank you, Rita. Linda, what do you think of me making L-Reuteri yogurt alone as a food? I think it's an excellent idea. You want to make your own yogurt? Linda? I love Lindas, by the way. Listen, Linda. Yeah, good for you. I love L-Reuteri, by the way. Okay? It's one of my favorite strains of probiotic. It's one of the best. I love L-Reuteri. I love L-rhamnosus. I love lactobacillus. I like a lot of different strains because they do different things. But yeah, I love L-Reuteri. You can make your own. Go for it. Good for you, Linda. Melody. Too much vitamin D raises your calcium levels to high ranges. It's possible, but that's not usually a cause from vitamin D. Melody. Usually if your calcium levels are going too high, it's not vitamin D. It is your parathyroid. They're not functioning properly. Parathyroid. You got two little pea-sized glands on the side of your thyroid, and they're called parathyroids. That's really what regulates calcium in your body more than vitamin D. Now, vitamin D, they always made a big thing of vitamin D. You take too much, you're gonna die. You know what, Melody? I don't buy it. And the reason, okay, because you said, so how do you take a good amount of vitamin D with K2 and not raise your calcium? Well, I got tens of thousands, no, more than that. Every day, Melody, taking good doses of vitamin D, and they're not raising their calcium at all. And the reason is, and that's the reason we put vitamin K2 in it, okay? Because what vitamin K2 does, it takes calcium and puts it where it belongs, okay? It takes calcium and puts it where it belongs. That's why I like the combination of vitamin D and calcium, okay? Now listen, I'm just going to tell you about a couple of studies that were done over the years on vitamin D to become toxic and make too much calcium. 50,000 IUs a day, 50,000. So 50,000 IUs a day, 6 months, every day, 7 days a week. And you can become toxic with vitamin D. I mean, who the heck takes that much vitamin D? But I like vitamin D with K2 because K2 takes calcium and puts it where it belongs. That's why in nature, okay, here's what God has done for us. Eat cheese. Okay, is there calcium in cheese? Oh, there sure is. Everybody knows that. There's a lot of calcium in dairy. Everybody knows that. You'll learn that in grade school. But what you don't learn in grade school is that when you eat an egg or meat or cheese, butter, dairy, you get calcium with vitamin K2. It's right in the package. God gave it to us to eat it because it'll take calcium that you're eating and put it in your bones where it belongs. Okay, so when I was talking about osteoporosis earlier, man, you got to eat your calcium. Okay, so Melody, I'm not worried about raising your calcium, because if you got elevated calcium, you got a parathyroid problem. You got a parathyroid problem. Got to check that. Okay, thank you for the question. Shirley, hi Shirley. Why is there no folate in your B12? My NP, nurse practitioner, said it's important to take with B12. Well, Shirley, in all due respect, I'm sorry. Your nurse practitioner is wrong. I.e., example, okay? You go get a B12 shot. You can get a B12 shot. They don't do it much anymore. They should. They don't put folate in the B12 shot. Okay? And I like folate. I got no problem with it. You know, babies, they give it for spina bifida and this and that, folic acid. But listen, you don't need folate in your B12. Okay? When you take a B12, a sublingual B12, you get the methylcobalamin. Hey, I disagree with your nurse practitioner. And Susan, here's another thing. Someone told me to have to take bromelain with quercetin to be effective. Is that true? No, it's not true. I've been using quercetin for eons of time. I like it for lungs. I like quercetin as a natural antihistamine. It's one of the best. I like combining quercetin with Navitol for a tremendous antihistamine. And bromelain, nah, I like bromelain, but you don't need bromelain with quercetin. Okay? And Naomi, besides B12, what other B vitamins is good for stress and anxiety? Well, eat your B12, eat your B vitamins. Eat a piece of steak, okay? You get all the B vitamins in the most bioavailable form. There's nothing better than get an egg, eat the yolk. You get all the B vitamins, okay? Dairy, a lot of B vitamins in the best form, okay? So for stress and anxiety, B vitamins, I like, of course, B12, absolutely, but I'd be more with magnesium in terms of stress and anxiety. And I'd be on our cortisol formula. Tremendous for stress and anxiety. Okay, I think I got all of them. I think I did. Okay. Guys, sorry for the fogginess. I don't know. I like I said, I thought I cleaned my lenses, but who knows with me. Okay, I'm a senior. I pull that card out every day. I'm a senior. I'm sorry. I take advantage of that. Okay, guys, we love you dearly and sincerely. Remember, Monday, if you haven't signed up yet for our live, we're doing a Q&A Monday night. Q&A Monday night, okay? So there'll be no podcast Monday, okay? There'll be no podcast Monday because we're doing a Q&A on Monday night. You sign up for that, and Tony Jr. is on with me, okay? You guys always ask about how's Dr. Martin Jr. doing? How's the brains of the operation doing? He's doing very well, and he'll be on with us on Monday night. You need to sign up for that to get the link to that webinar, okay? That's Monday evening, live. Ask all the questions you want, okay? We're on there for the Q&A. Okay, we'll talk to you soon. Love you.